decade ago, it wouldn't have seemed possible that almost 1 million children would be on treatment for HIV, and the number of children newly infected with HIV each year would be cut in half. In just 10 years, we have made extraordinary progress, but there is still much more work to do before we claim victory. Every 3 minutes, an infant is infected with HIV. That's nearly 500 new infections occurring daily worldwide. Only half of babies born to HIV-infected mothers receive early infant diagnosis services. And UNAIDS estimates that over half of all children currently living with HIV still need to be identified and enrolled in treatment. Also at great risk are our young people and adolescents, who are the only age group for which HIV-related deaths have increased over the last decade. But past success in HIV treatment and access inspires us to believe in the impossible. It inspires us to believe that we can prevent new infections, as well as find, link, and retain children and adolescents in care. To reach the UNAIDS 95-95-95 targets by 2030, we need to go faster. Faith-based action for scaling up testing and treatment for epidemic response is a project that aims to ensure children and adolescents achieve viral suppression in some of the countries with the highest unmet pediatric need: Nigeria, Uganda, Tanzania, Zimbabwe, and Zambia. Through the FASTER project, Catholic Relief Services and the Clinton Health Access Initiative are mobilizing government, civil society, and faith-based organizations to reach those children who might otherwise be left behind. The FASTER initiative is focused on 6 priority actions to reach children and adolescents with testing and treatment. Priority Action 1: streamline regulatory approvals so that new drugs and diagnostics for children are able to be rolled out more quickly. Priority Action 2: integrate Ministry of Health and faith-based organization service delivery for interoperability of testing and treatment services. Priority Action 3: expand diagnostic platforms to improve timely HIV and TB diagnoses in infants. Priority Action 4: evaluate novel HIV testing approaches such as the feasibility and acceptability of caregiver-assisted oral fluid-based HIV screening for index testing of children. Priority Action 5: implement validated HIV Risk Screening Tools so that we can better find children and adolescents through outpatient departments, OVC programs, and community settings. Priority Action 6: optimize pediatric anti-retroviral therapy regimens by overcoming barriers to development, testing, and introduction of pediatric antiretrovirals. With stakeholders working together, FASTER can reach all affected children, better treatment options, healthier children, an end to the HIV epidemic. FASTER.